Okay, today is Friday, April 11, 2008, and this is Stephen Fagan, the oral historian at the Sixth Floor Museum at Dealey Plaza. And the interview we're doing today is part of the museum's ongoing oral history project. And today it's a great honor to be talking to Dr. Kenneth Salyer. Thank you so much for taking the time to visit the museum today and share some memories with us.
Thank you very much. It's a pleasure to be here, and it's been long overdue.
Well, we'll certainly tour the museum after we do this oral history.
Okay.
And take a look around.
Good.
At the beginning, sir, just for the record, I'd like to get your full name, your date and place of birth, and just a little background about yourself.
Okay. Kenneth E. Salyer. I was born on August the 18th, 1936 in Kansas City, Kansas. And I grew up in Kansas and went to the University of Kansas, graduated from the University of Kansas Medical School in 1962. My father was a dentist there and got me interested in the field of dentistry and medicine, and he was a hero of mine. And so I was in dental school and then switched and went to medical school and was glad I made that change. So in 1961, I was looking around the country to decide where to do a good internship, and looked at a number of major hospitals around the country, and one of them was Parkland Hospital. And that seemed to offer me the kind of hands-on experience that I had desired as a young budding doctor. I had been in a good medical school and was pleased with Kansas, but I was ready to move on. So we came to Dallas, and that's how I ended up July 1, 1962 as a intern at Parkland.
Can you give me your first impressions of the city when you got here?
First impressions of the city was, in a way, it was similar. I grew up in Kansas City, and the Kansas City, Missouri, and Dallas seemed to be similar, although I was moved by the people in Dallas, who seemed to be quite open and friendly, and I liked the weather and the setting. But Dallas in 1962 is quite different than Dallas in the year 2008.
Now, you would have been a young man in your early mid-20s at this point?
Yes. In November 22nd, 1963, I would have been 26 years old. And I was a second year, which would be a PG2 in today's hierarchy. I was really a first year resident on neurosurgery call, and we rotated at that time on different surgical services. And I had made up my mind as an intern. I was so excited about the young, vibrant surgery department headed by G. Tom Shires and staffed by relatively very young and exciting staff, Bob McClellan, Malcolm Perry, Charlie Baxter, and many others. So this is really the reason I was attracted here and decided to stay here and was accepted for a surgery training program.
Now, for the folks that are going to be watching this interview who were not alive in 1963, could you talk a little bit about Parkland, the layout of Parkland, because it's changed quite dramatically over the last 45 years?
I remember entering Parkland Hospital through the main doors, and this was now the new Parkland. The old Parkland Hospital was off of Oak Lawn, and as a matter of fact, one of my very first rotations at Parkland in 1962 was on the chest service of Parkland, Dallas County, and it was at the old Parkland Hospital on Oak Lawn. And I remember at that time as a young intern, having a patient with asthma. And that patient, I did everything I could for her, and I went home that night and another doctor was looking after her, but the next morning she had expired. So that was early on for me as a surgeon or as a physician, starting to learn to deal with death. And the Parkland experience was a big experience in trauma. And Parkland was one of the leading trauma centers in the country, and was one of the reasons that I wanted to actually be in Parkland, was to have the experience to become a good surgeon. And certainly I did gain that at Parkland Hospital during I ended up spending 5 years there, the year of internship and 4 more years in general surgery. And I actually I went away back to Kansas, trained in plastic surgery, and came back to Parkland and UT Southwestern and founded the first plastic surgery training program in Dallas-Fort Worth. And that's gone on to become nationally and internationally known. So I'm very proud of that fact.
Now, outside of Parkland, as a young man living in Dallas in the early 60s, what was of interest to you? What was on your mind at this time?
Really, my focus and on my mind at that time was to become trained as a good surgeon. And I spent almost all of my hours waking day and night in Parkland. That was before the days of the restriction on the work week. So it was nothing that we were working 80, 90, 100, 110, 20-hour work week. So I was really focused on that. I had during that period, I had 2 young children and a wife, and I was just starting my family and my personal life, and I had many friends, but most of it centered around medicine and Parkland Hospital.
What impressions can you share with me about race relations in Dallas at this time in the early 60s?
Well, that was a turbulent time, and I had grown up in an area where discrimination was not as prevalent, was not an issue for me. And I'd really not been exposed to it. And my first experience in entering Parkland Hospital, I was taken back by the fact that there were a separate entrance for blacks and a separate entrance for whites. And then when we were with our patients on the ward at Parkland Hospital, we had a separation, so that the blacks were on one floor, and whites and Caucasians and Latinos were on another floor.
And that was the way it was at the time of the assassination?
That was the way it was at the time of the assassination, yes.
What about John F. Kennedy, your personal impressions of the president?
John F. Kennedy was another one of my heroes. I had voted for him. I was totally taken with him, with the whole story, with the era of the Camelot impression of here was a very vibrant, young, energetic president and leader of our country, and I was totally taken with him, and I was totally impressed with what was going on and what he was doing. And of course, those were times in which there was a lot of turbulence in terms of just the Vietnam War and many issues that were plus the racial issues that we've already mentioned.
You would have been at Parkland during the 13 days of the Cuban Missile Crisis. Did Parkland have any plans in case of a nuclear war with Russia?
No, we didn't. We were designated as the #1 trauma evacuation center for the city. And obviously it had been designated on the morning of Kennedy's being here that if there was any potential problem, why, that's where they'd be taken. And that's where all major trauma in the city was taken at that time. So, but we didn't have a plan in case there was a Cuban missile problem.
This was a historic transition between Dwight Eisenhower, who at that time was the oldest president in American history, and this young and vibrant person, John F. Kennedy, with his young wife and his 2 kids. Did you feel at this moment that it was history, or was that something that has developed later on after the assassination?
No, I felt at that moment that it was, and I felt at that moment that we were on an exciting new turn in terms of addressing the issues of our country and looking at what was going to happen. And I was really taken up in the wave of enthusiasm with Kennedy and with what he was doing, and I was very impressed that he was for the man on the street and was for the underprivileged and for integration.
Did you know that Kennedy was going to be in Dallas on November?
I knew that Kennedy was going to be in Dallas. I'd seen some of the video, black and white video, as I remember, although it may have been color. Let's see, was it color? No. In '63, I guess it was color.
TV sets would have been
Yeah,
all
it
black
was.
and white. TV sets at that time would have still been all black and white.
Yeah, I guess they were black and white. The reason is, no, I remember now. The reason I remember the color was subsequent looking at films of that. But at that time, it was black and white, right?
Was there any discussion among your colleagues about, wishing you could go and see the president or see the motorcade, missing out on that opportunity?
No, there wasn't that discussion. Certainly there was the discussion he was in town. It was, we were aware of that, but we were on call, and I was used to missing all kinds of events and being not available and being there in the hospital where even my family would come on Sundays to have Sunday dinner in the hospital when I was on call. So on trauma call, we were on call every other day, every other night, and then we'd go, so we'd be in the hospital 36 hours and then home for 12 and back again, and have one day a weekend off. And I did that month in and month out. So that was quite an experience.
Can you share what a typical day would have been like for you at Parkland?
The typical day at Parkland would depend on whether it was a weekend or during the week. But even during the week, it could be that when I was on, say, trauma call or on surgery call, that I would not get any sleep that night. But if it was Friday night, Saturday night, we would literally then talk about the Dallas Knife and Gun Club. And it was that one operation after another that we'd be taking care of traumatic injuries, automobile accidents, and gunshot wounds and stabbing. So, I mean, obviously as a city-county hospital and the only major city-county hospital in the area and the #1 primary trauma referral center, why that was what we were doing mostly there. Plus taking care of the indigent patients. So in different rotations would be different things. But a typical day would be make rounds early in the morning, be responsible for drawing all of our own bloods and our own ordering our orders, making rounds with the hierarchy of attendings and staff. Normally, the second-year surgery resident ran the service. The senior resident, which was the fourth year, would act as almost as an attending. And then we would have our attendings that would make rounds with us designated times later in the evening or day, and we'd have organized conferences and presentations. So that was sort of a, Thursday conference was the weekly big conference period when we as house officers would present our patients and discuss with the staff in front of everyone the particular cases that were done that week. So you can imagine the discussion in the surgery rounds when we in the same week discussed the two patients that had been in that week among all the others, which were Lee Harvey Oswald and JFK. So there was ongoing hours of scientific discussion about the type of injury, et cetera, that went on with both situations. And I remember particularly the discussion of Lee Harvey Oswald because I was not an attending for him. I did not take care of him, but I remembered the description, and G. Tom Shires, who has just recently passed away, who was our professor and chairman of the Department of Surgery, got there in time and operated on Lee Harvey Oswald. And he was talking about his entrance, shot in the abdomen, this thing like went inside and it just went like around and around, was what we talked about at that conference. And it was like a major injury, which was, again, he could not be salvaged. It was a lethal injury. And the injury of JFK was a lethal injury. And most of the injuries we'd see at Parkland were low velocity injuries. So it was impressive. One of the first major things was when I walked in the room with JFK, I was the third physician in the room. Jim Carrico was on call in the emergency room, and we rotated that as first-year residents or second PG year, and he was in charge down there. So he was already in the room and was working on him when I entered. And Malcolm Perry was there fairly soon after that, or was there. And the issue then was just getting him undressed. So we started working on him, and that's routine. You get all the clothes off, and then the main thing is maintaining airway and maintaining hemorrhage. He had a major sucking wound of the neck, and he had the right side of the cranium open, where there was open gray matter, and this whole side of the right-hand side of the face skull was back as a major open wound. And I went in and was on his right side and started working on him. And the main first step was just taking off his clothes. He had a large white back brace on. And in addition, all of us were talking with one another, and as we were talking and working on him, more and more doctors on call and or involved would arrive. But we were there working on him, and the initial thing was trying to get an airway. And at the moment I was first in the room, he did not have an adequate airway. We tried to intubate him and could not successfully intubate him. So the sucking wound of the neck was expanded and the tube was placed in there. At that point in time, he was still agonal. He had not expired. He was not dead. I mean, there was still some agonal movements. So I started an IV on the right side, on the right arm, and we started working on resuscitation of him. Now, my memory of this whole event was that the trauma room was about the size of this room, trauma room number 1. And certainly I have a vivid memory of that room this moment, and I haven't been back or visited that room since. I guess you have that room now here in the museum?
Actually, it's in the National Archives.
It's in the National Archives. Well, that's too bad. Let's see, and didn't I recall or see something that it's right now stored in Kansas City, of all places? My old hometown?
It was in Fort Worth for many years, and the crates had never been unpacked, and it was taken to another location. I can't remember if it was Kansas City or not, but that was just recently that occurred.
Well, I can tell you to this day, how it looked and the equipment and the things that are in that room and the exact arrangement and where I was standing. It was longer one direction than the other, and so the Kennedy's was in the center up at the top, and I was on the right-hand side. In coming through the doors that way were different people were in the room then by that time, including Jacqueline Kennedy. So Jacqueline Kennedy was in the room basically the whole time we were working on him and resuscitating him. She was standing over in the right-hand corner. And from time to time when I was working, when we were working on him, I would look up and would see her and made eye contact with her. At one time, during the period, she slumped down in the corner, was stooped down in the corner, and then was back up. And there were others around her.
People. Pause just for a second.
Yeah.
Okay. If you would, just tell me about when you made eye contact with Jackie and what you noticed.
Yeah, what I noticed was that she was a beautiful lady, even though she had on her peach-colored suit with splattered blood and gray matter, white or brain matter from JFK. And she was obviously very distraught, and this was a very moving, tragic moment. being there, taking care of my hero, taking care of the President of the United States. However, we all went through what we had been well trained to do. It was not any hesitancy, not any, okay, this is the President. You know, everyone in that room were very well trained trauma doctors, and by the time we started working on him and got him undressed and got him intubated, why the room was full of doctors and nurses and attendings, and we were trying to maintain him, and so we were doing external cardiac massage, and we were pushing on his chest, and we took turns in doing that, and maintaining blood flow. Trying to see if there's any possibility for resuscitation. The wound on the right-hand side was open and was like tissue flat back. We did not turn him over. We were not doing a forensic diagnostic study. We were trying to resuscitate our hero and the President of the United States. So we're doing everything we could to save his life. And that was our concentration. We were not at that moment, nor were we aware of anything other than the President was here and was fatally injured. This was one of my first experiences with major higher velocity wounds of the head, and little did I know that I would suspect that he had a major injury to his sagittal sinus, which would mean that it's almost it's a given lethal injury. Little did I know that subsequently in my career I would be dealing with the sagittal sinus, doing intracranial procedures, dealing with this similar structure, which became our nemesis in the development of craniofacial surgery, and which subsequently I led the team that separated the Egyptian twins, and the main issues were neurosurgical in trying to develop a venous drainage system where they had a very abnormal sagittal sinus. And what I observed as a visiting professor one time at the University of Mexico was we were standing there as visiting experts, and the neurosurgeon got into the sagittal sinus in a little child, and the child within 1 minute was gone. So that's the indication of a significance of a sagittal sinus injury. I think that it's a very serious situation when you're in the sagittal sinus because you can't stop the bleeding. So anyway, that's a subsequent speculation on my part as a surgeon and one who ends up in that field of endeavor. But I feel that he, without a doubt, had a lethal injury, but we were certainly trying to bring our hero back to what we could and working on him. And we worked on him for about an hour or longer to see if there was any possibility. So then there were decisions made. By that time, Kemp Clark, who was chief of neurosurgery, was there. Pepper Jenkins, who was chief of anesthesiology, was there. Although it didn't really have much to do with that, Paul Peters, who was chief of urology, was there. So we had Charlie Baxter, who was one of our attendings, was there, and Malcolm Perry. So we had all of our young professors there and our attendings, and decisions were made. Okay, we stopped the EKG, we stopped the resuscitation and look at the EKG, and the EKG is a straight line. And so we start again though, and then finally the decision is by the group, but mainly by the attendings, is okay, I think we've done everything we can do. And so the president was pronounced dead at that point in time.
Now, is it true that the official pronouncement was held off until the priest could arrive to administer the last rites?
I don't remember that. It could be. I don't remember that exact fact. Let me say what I do remember. I was moved by the moment tremendously, and so I stayed in the room up at the right-hand side of JFK, and everybody else started exiting. So all the doctors that were in there, I think almost all of them, as I remember, all of them exited. There were some men, I guess Secret Service was in there, and there was, to go back on the story, we knew by history that Kennedy was on steroids. We knew this history, and so we had already given him steroids. I'd started blood in the right arm at the time. We were doing everything we could, Ringer's lactate, so forth. After we were near all of that, at least like 3/4 through, then his private physician came in the room. I remember him coming in the room and saying, "Have you given him steroids?" And we said, "Yes, we've already done that."
How would you have known to do that?
We would know to do that on the basis of doing everything we can to resuscitate a person. Today, when we do elective surgery to cut down on swelling, we'll give a large bolus of steroids. So this was something we would have done, but we knew in our minds already that he had a Cushing. He had a history of Addison's, not Cushing's. Cushingoid is where you have too much. He had a history of Addison's disease, an Addisonian. So we knew that he was on steroids just by history, but we would have done that anyway. So everyone exited. I stayed in the room. The priest of the Catholic Church came in. He administered the last rites. This is what I remember, and I still remained there. There was hardly anyone else in the room at this time. Jacqueline Kennedy was in the room. She came over, leaned over him, over his chest, and she did a ring ceremony. She did a ring exchange ceremony that I witnessed. I've never officially told that story before, and I don't know if you probably have anything in your records anywhere about that, because I don't think there's any other physician in the room at this time.
Could you describe what the ceremony entailed?
Well, no, I can't. My memory is that she was obviously distraught, very unhappy, but picked up his hand, and there was some motion of ring, but I don't know, or my memory doesn't say whether she put a ring off her finger onto his or off his onto hers, but there was that exchange that took place, and I witnessed that.
What effect did this have on you? I mean, here was the President of the United States in this very intimate moment after having passed away.
I was totally moved by the experience and totally taken. I think the reason that I didn't leave was that I was so taken by the moment that I was just like, okay, now that I've gone through my routine of trying to save his life. Now, okay, what do I do now? Here I am. I'm spent. But I was just totally, this is our president. He's gone, and here's his wife, who is totally taken away by the whole situation. I mean, so I'm still standing there. And there's silence, and finally the Secret Service comes up and said, "Okay, we're taking him," and they're putting him into the plastic bag, and I'm still standing there, and Jacqueline is there, and then they go out the door, taking his body, and then at the door, or out the door, there's a lot of commotion, and there's a lot of discussion, and there was hesitancy on their part for a moment, and then they went on and took him away, and that was the end of my seeing him and Jacqueline Kennedy.
Now, the president, was he in a coffin at this point?
He was in a plastic bag. I don't remember that he was in a coffin.
Do you remember the controversy over whether the body should have an autopsy performed
Yeah.
here at Parkland?
I think that's what was going on outside the door. And I remember then subsequently, and at the time, I remember that. And then I remember from discussions with my colleagues about the stories that they wanted to keep him there and do an autopsy, and the Secret Service says, no way, we're taking him away, and that's it. We're in charge. We're it.
I'd like to go back and ask a couple of questions about the treatment of the president, if you don't mind. When you first entered the room and saw the wound to the president's head, was there any doubt in your mind that that was a fatal wound?
Let me say this. I can't say that there was no. I would answer that no. It was not a given that it's a fatal wound. Why? I had already had experience with my own self where I'd had a patient in a similar room where he'd had a gunshot wound, major, where I'd put my hand and tamponaded the aorta and personally taken him to the operating room with my hand there myself and saved his life. So, and I'd done that myself by that time, or certainly been involved in that. So I, as a treating physician, never give up. And never give up until that moment of pronouncing the patient dead, until we are sure. So when you have a patient that's agonal, even though the injury, what's the assessment? The assessment would be if he lived with this injury, we would have a majorly mentally disabled president. But is there the possibility that he could live at the moment you walk in there? Yes, there's a possibility. We can get an airway. The wound is something that can be closed. The question is enough blood flowing to perfuse the organs to preserve viability and life. And so walking in there, there's a chance that we can save his life. It's not like this man is gone. That's not my position. It never has been and probably never will be. So it's also a personal experience, and it's where you're coming from and your point of view. Now, it'd be interesting. I've not read the testimonies or heard the testimonies or paid attention to anybody else's testimony, and I'm sure there'll be someone in there who would say yes. And while we're on this, let's talk about this. A number of people have done a number of different things. One of my fellow residents who was working on the left side of him is a fellow named Chuck Crenshaw, Charles Crenshaw. He's no longer alive. He did a book, and in that book, he made a number of statements and a number of observations. And I remember looking and reading that and totally not agreeing with it. So I didn't agree with my fellow residents' observations, who was right there on the left-hand side of JFK while I was on the right-hand side. And I remember him very specifically. As a matter of fact, Larry King contacted me one time and said that he was going to be on, and would I be willing to be on to more or less debate with him? And I said yes, I would. And there was some event that happened that same evening, so that it was canceled. It was someone else was I think it was another assassination or something. Anyway, it never came about, but I'm just giving you that as a little bit of background information.
How did the other doctors that were involved in the trauma room there with the president, how did they feel when Crenshaw's book came out and sort of told this version?
Yeah, I think that there were those who were in disagreement with it, and there were some who were neutral, and maybe some who agreed. So I think there's a division among all of us who were there about the exact sequence of events and what happened and our observation of that.
Is there anything specific you can recall that you feel was just completely inaccurate?
No, if you would give me a fact, I would be happy to react to it. But to just pull one out of the air right now, I be honest with you, until this interview, I have not had this discussion, and officially I've never had this discussion. I've never done this interview before for the public. I've done a tremendous number of interviews in my field as someone who's been a leader and past president of a number of our societies, and a leading surgeon who's been a pioneer of craniofacial surgery in this country. So I'm used to doing interviews, but I left this topic off my agenda until really today. I've not done this interview. This is the first time.
Really?
Yeah.
I'm very honored to be the one to...
I do remember, I'll go back on that. There was someone doing a book at one time, and I told them I gave some answers and so forth, or answered some specific questions he had, or made some comments. I have done that a few times, but I waited maybe 20 or 25 years before I commented. And one of the things that was discussed was we were there as house officers, and our attendings, which were Malcolm Perry and Charlie Baxter and Bob McClellan, and my attending at that time was Dr. Clark, Clark Kemp. I don't want to mix him up with
Kemp Clark.
Yeah, Kemp Clark. He was my attending for that period because I was on neurosurgery. And then it's interesting, my next rotation, I rotated on thoracic, and who was I taking care of then but John Connolly.
Really?
So I took care of John Connolly, and I became well acquainted with him and his wife, and would see him every day while he was in the hospital and make rounds on him and take care of him.
Was he isolated in a certain part of the hospital?
He was in trauma room number 2, across when we were taking care of JFK in trauma room number 1, across the hall was another group of staff members like ourselves taking care of him. And then he was up on the ward in Parkland, on the thoracic surgery service room, but he was not isolated in any, not the way we do it today. Today we would have, if possible, we'd have private entrances and exits and the whole thing. I was just in the hospital in NYU as visiting professor at Cornell, and they were showing me the back elevators where they used, because they did the triple bypass on Bill Clinton, and they were showing where Hillary would come in and out and have her own entrance and own exit, and they totally isolated. We didn't have that in 1963. We did not.
Going back once more to trauma room 1, without having turned the president over and examined the back of his head, would you be able to assess whether or not there was a gunshot wound from the front or from the back?
Yeah, that's a loaded question.
No pun intended.
Yeah. We subsequently discussed that and talked about it, and in all honesty, from my observation, I didn't look at the wound in the back of the neck. So the wound in the front of the neck, due to the size of the wound, which in the front of the neck was, my memory was about like this. And we did take that and expand it to get the trachea in. So that wound, depending on the velocity and so forth, could have been an entrance wound or an exit wound. The wound of the head was a tangential wound. But But based on flap analysis and subsequent thinking about it, it most likely was a wound that was with a tissue. This was, when I saw him, was open. But this wound then was, I saw a picture of him after they did, or during, or whatever, the autopsy, the public pictures of him on the slab, and this was then closed. And so if this was closed, then that means this flap of tissue had to go back like this. This is all speculation now. So if that's the case, then that, even though that's a tangential wound and could have come from the front or the back, it would most likely have come from the front. I'll leave it for history. Now, my testimony I haven't reread my testimony, but my testimony at the time with the Warren Commission report, and it was typed up about a page and a half or whatever. You probably have it there.
I have it right here, yeah.
But I basically went along with and supported and have believed in my own mind that it could have been Lee Harvey Oswald. It did not have to be a conspiracy. Now, when Oliver Stone did JFK movie, he did an extensive interview of me, and Lucy was there. And I signed off, and he had someone playing me with a white coat on with my name on it in the movie. But the way he depicted the scene in the emergency room, in trauma room number 1, was not the way it happened. And then the way he depicted the story was he was making a Hollywood movie, and his plot was that it was a conspiracy. So, I mean, he was prejudiced. This is what he was going to see. This is the way he took whatever facts I and others told him, and he took them and dealt with them in the way that he wanted to. This is a fictitious movie, not a documentary. Bottom line.
Before we started the recording today, you mentioned that the reason that your Warren Commission deposition was so short was that you were somewhat reluctant to give very many details.
Oh, yeah. Let's go over that. I was going to make that statement, and I got off on something else. We were told by Dr. Baxter, Dr. Perry, and our attendings that we were not to do any interviews, and we were not to have any discussions with this, and we decided we were not going to even have discussions with this amongst ourselves. And so we were told this is the way it would be. So, okay, Warren Commission report, fine. But I went in there with the idea I'll answer their questions, yes, no, and not volunteer any additional information. I'll simply answer them the best I can to my knowledge based on what they ask me. I'm not going there to give a dialogue or a deposition like I would here, or anything that's been worked out or thought about. I'll just answer their questions.
Have any of the subsequent government investigations, the House Select Committee in the 70s or the Records Review Board in the 90s, did any of them contact you for additional information?
None. Not at all.
When you saw those autopsy photographs, which I believe first came to light around '88, around the 25th anniversary.
Yeah, that's about the time that I first, 25th anniversary, and I'm sorry to interrupt you, but that's about the first time that I started even really giving thought to the details of what was going on. I somehow felt removed from it. I felt like this was a situation that I revered as a special moment in history. It was a very moving moment for me. It was a very emotional moment. And so I just say it's not my place to speculate, as I just did, on whether there was a conspiracy or anything. I mean, that's only an opinion by an observer. So that's what it is, an opinion by an observer. I'm involved because I helped take care of him, And because of that, I have felt a special connection my whole life to the to the Kennedy family, just as having played that tragic moment in our history. But I have been more interested. I read a lot about JFK out of interest. I was interested in Bobby Kennedy. I was a supporter of his, and I ended up meeting the photographer that was on the trip with Robert Kennedy, who took that famous photograph of him when he was shot, and then I ended up meeting Robert Kennedy's, who was it, Lucy? Robert Kennedy's son? Patrick Kennedy. And so I was on the same program at a meeting. It was called Barnstorm, and I met a Pulitzer Prize winning photographer, Eddie Adams, and he did a story on me for Parade magazine. And he was the one that took the Pulitzer Prize winning photograph of the shot of the Vietnamese general. And so he invites VIPs to his Barnstorm every year. He's no longer with us either. He died of ALS. And at that meeting was Kennedy giving a talk. So I met him, and I think also one of the daughters, one of the sisters. But anyway.
When you first saw those autopsy photographs, your initial reaction, was it this resembles what I remember, or was it this looks completely different from what I saw at Parkland Hospital?
Different. Yeah, completely different.
Did that concern you?
Yeah. It concerned me. I was concerned. This made me suspicious. How this isn't the way it was. This was my comment. This was not the way I remembered it. This was not the wound that I remember. And so, okay, I was speculating, how can they have made this like it was? So they must have taken the wounds that I remembered and somehow sewn them up, but that's not the way I remembered it at all. This was an open, gaping hole in the whole side of the cranium, open, skull gone, open brain. That was the injury.
Are you familiar with the various theories which suggest that maybe those photographs were doctored or faked in some way?
I am familiar with that.
And do you have an opinion on that?
I think that's a possibility. That would be all that I could say. I cannot comment as any kind of authority. I have not spent, I'm a detailed planning kind of person. The planning of the separation of the Egyptian twins took a year, every single step, and it took the design of a table that had never been done before or existed, and all of the things that go into that. So I'm a real detailed person. And so I would say for me to answer that, would require me to know all those details and then make a remark about it. So I'm going to refrain from that.
What about the single bullet or the magic bullet theory? Do you have a comment on that?
The Warren Commission worked it out and thought it was possible, but it seems improbable.
So can I take it just from our conversation today that you're more likely inclined to believe that there was a conspiracy of some kind? Just your personal opinion?
No.
Really?
No. My personal opinion is that Lee Harvey Oswald alone could have made that possible. So I don't believe necessarily a conspiracy. However, speculating on those facts, and based on what I just said myself, you would think I would believe in a conspiracy, but I don't believe in a conspiracy.
What impact did the assassination have on Parkland Hospital?
Well, what impact did it have on Parkland? I think it brought additional recognition to Parkland Hospital as a trauma center. I think it brought recognition to Parkland as a place where Kennedy was treated. I think his assassination of Dallas brought this city for the next 25 years, wherever I was or traveled, nationally, internationally, this Dallas, what's Dallas known for? Dallas is known for the city where JFK was shot, which is not exactly the way I would like to have people remember Dallas, obviously, but those were the facts. I think this has been dispersed with time a bit. I mean, people do think of other things now.
Something that we actually didn't get into was how you first found out that the president had been shot.
Mm-hmm. We were upstairs in the Parkland dining room, and we were talking then about the president was here and the motorcade and so forth. And shortly after that time, the word came to me: the president has been shot. So immediately I went to the emergency room, and so it was one of the first physicians there.
Was there already Secret Service and police officers in the...
There's already Secret Service, but there were much more outside. There was a lot of chaos outside. There was no really chaos inside. The chaos was outside. The Secret Service people were outside. There were a lot of people outside, but an orchestrated, organized approach inside the room from my assessment then and now.
Were you still at Parkland when Jack Ruby was admitted in late 1966?
I was still there, but I didn't have anything to do with that.
Never saw him?
Never saw him, never took care of him. I was totally on a different service.
Any other stories or connections to this event that we haven't touched on that you think we should?
I don't know. Lucy, anything else that you think I left out or I've commented about the years? No, it's interesting, I think, to look back after 45 years?
Almost, this next
It'll
November.
be 45 years, yeah. To look back now and think about it and see all of the players who were there who have moved on in the world. And I was just at a meeting where 18 individuals I had passed away this year that I knew in my field of plastic surgery, and who were leaders, and I knew them personally. And so knowing these people personally, I remember them in detail and their personalities and their characteristics, and I see them to this day. And I think that was a moment in time which is a significant moment in history. The discussions we had in the conference rooms about the type of injury and so forth, I think the discussion about Kennedy's injury was it was a lethal injury. There was no way that we're going to save him, and no way it could be saved. He could be saved. And I think there was probably opinions when of some of the doctors when they walked in the room that they would have the opinion this is a lethal injury. But as I said, my position is, and until proven otherwise, it's the potential still exists that he could be resuscitated. But in this case, destiny had it that this was his moment in time and was the end of his life. So, but dearly, I've thought about that time and many times, and I think it's had a big impact on me for my entire career and my entire life. And it's nothing that certainly I would ever forget, but it certainly, I think, impacted me as the kind of person I've been and the kind of person I've lived, the life I've lived. I've been someone who's been very fortunate to be very successful in my field and pioneered and developed my field, and I'm totally now on a track of giving back totally to society and to children with these kind of problems.
Does it surprise you that this site and the assassination itself still generates so much interest among people who weren't even alive at the time?
No, it doesn't. I think that, I was fascinated by the story of the assassination of Lincoln and the details. And I went there and looked at the theater and so I think that it's only natural when we have presidents or someone of that level, and then when you have someone like JFK, who was a particularly to me a particularly attractive, endearing, magical moment in time and history that came to a sudden end, and one would have to speculate what would have happened in history and in time if that event did not occur. And I think our history would be much different than it was with Johnson and his subsequent followers, or the subsequent presidents that followed.
I remembered one specific question I had on my list.
Okay.
Dr. Robert Grossman.
Yeah. Okay.
You mentioned him in your deposition.
Yeah, I mentioned him in there. He was a neurosurgeon, and at that time, I guess he was a young attending in neurosurgery.
In the last few
And the
years,
reason I mentioned him is because I was on neurosurgery at that time, so I was focused on my attendings in neurosurgery.
he's become quite a controversial figure, at least in the research community, because over the last few years he's begun giving interviews and professes to have played a very significant role examining the president's head wound and being there the entire time. And you're actually one of the only physicians that even remembers him being in Trauma Room 1.
Mm-hmm.
Can you share any insight as to what you remember him doing or being involved in there?
Yeah, I would say that he was there as one of the attendings, but I do not have any recollection of him playing any more of a significant role than any of the people that I mentioned in this interview. As a matter of fact, I didn't mention him in this interview until you mentioned him, because I do not have a recollection of him today playing a significant role in the resuscitation. The resuscitation was done by people trained in general surgery. In other words, I was there on neurosurgery, but I was there as a general surgeon, like the people I mentioned, Jim Carrico, Malcolm Perry, Bob McClellan, and these are the people who were specifically high-level training, specifically directed to taking care of the acute emergency part of the wound. Dr. Grossman's role would have been, if the president lived at this moment, Dr. Grossman would have then been the surgeon, along with Dr. Clark and myself, being as I'm rotating on the service, to be working on the wound of the head in the operating room under sterile conditions to repair that injury and clean it and close it. And that would be his job then. So the acute resuscitation process, he's observing or standing back, letting those the general surgeons who are trained to do that or who are there to do it. So that would be my comment.
Anything else you could think of before we wrap
No,
up?
interesting. I'm sure if you gave me something to respond to, I would respond to something else. Maybe we'll do this again sometime.
You'd like to look at your
Yeah, let's look at this.
there.
Yeah, I haven't looked at this for a long time. Yeah, Mr. Spector.
Where was that interview done? Do you remember?
It was done at Parkland in one of the thing downstairs in the first floor, in like in one of the dining rooms, or one of the. They had it set up for sort of a. So they would parade us in individually, one after the other, and did this. But it was really, as you can see, to me, it was a pretty superficial thing. Not much.
Did you have to fill out any sort of report at Parkland based on what you did that day?
No, we did not. As a matter of fact, I think we were encouraged by, the press. That was one of my first experiences with the press, and at that time I had no in-depth experience. I didn't know that I would become very comfortable with the press and be able to do interviews and be very comfortable. And since then, I've been on Oprah Winfrey and Good Morning America, and I feel very comfortable doing that. But at that time, you know, the word from our mentors was, you know, not to talk, not to do interviews, and what that was for us as house officers in surgery. I saw during that period of time nursing students or someone that did some interview and they end up losing their job, and there were a number of issues that came up over the press, and then the story about the Saturday Evening Post with Malcolm Perry with quotes that, and he never did an interview that I know of, never did a formal interview. So it was a little slanted view at that time about the press, and actually I was probably frightened by them and was shunned away from them. and I've learned to develop a respect of the good ones, and I know the difference between good ones and bad ones, and can pretty well take care of myself. It's interesting, I'm just looking here to see who I recall was in the room. So, but you say I said that Dr. Grossman was in there? I didn't see it. I must have mentioned him later, huh? Oh yeah, I see here. Doctor who? Dr. Grossman, just briefly. He's a neurosurgeon. And the reason I knew about him is because I was on neurosurgery. So that's probably the reason. The others would not have thought about him because, or mentioned him because, see, the mainstream, the main emphasis was general surgery. And the people here are general surgeons. And that's who's running the show in the emergency room. Jim Carrico was in charge as a first-year resident. He was a fellow resident of mine. We were at the same level of training. And he was in charge, and then we were answering to the attendings that we talked about. So Grossman is just one of the neurosurgeons there in that way. Okay.
Wonderful. Well, I certainly appreciate you taking the time. I enjoyed talking to you.
All right, well, we'll have this be a bit of history now. So hopefully someone wants to research this, they can go back and see what we had to say.
We hope these will be available 100 years from now when we're all gone.
I hope so.
Well, you had an opportunity to go upstairs, and now you're back, and we're back in the same room again. You remembered something that you had failed to mention earlier, so let's talk about that.
And when I came in the room, JFK was still dressed, and we cut off and took him out of his back brace. And one of the questions I had for you, and you can answer it later, is do you have that brace?
No, we don't.
You don't?
We don't.
Did they ever identify it or find it?
All of the president's clothes, everything that was in his pockets, that all went back to Washington. I believe the clothing is in the National Archives.
But do you know whether the brace is there or not?
I don't know. I've never heard about what happened to the brace. I know.
I'm not the only person that talked about it, am I?
No, I know he had one on, but I don't know what happened.
I think that also the brace influenced. We didn't talk about this. From the type of brace I saw, this was like a corset. And I remember the brace as we took it off, and it was like coming from down in his pelvic bone all the way up his chest. You know, so it covered his entire abdomen, and it would keep him from just collapsing, or collapsing like this. He would have to bend like this. So I would think that may have had some influence in the first shot, second shot, and in what happened. And I haven't looked at that sequence, but now I'm motivated to look at it. And the other point we talked about before, as we talked about the injury and so forth, and I talked about the wound, and I said, well, this was an avulsion. The pictures that I saw back in Washington were different, and he looked different, like it had been, something had been done to it from what I saw him on the emergency room table when I took care of him. But one of the points would be he could have had an entrance wound from the back, The entrance wound in a velocity like this, from my understanding, is smaller than the exit wound. So he could have had an entrance wound in the back, and this that I was seeing here was an exit wound. That's a logical thing. But the flap of tissue, well, I'm not sure where that came from, or it was stuffed underneath the back of his head at the time I was taking care of him, because I don't remember See, the thing is, since I've been there, I've become trained as a plastic surgeon and as a craniofacial surgeon. So now I'm really tuned in to flaps of tissue and incisions and so forth. And at that time I wasn't. So the question is, how did this flap come? You know, was it like, because from my point of view, then if what I saw in Washington was correct, then it means the only way they did is they somehow sewed this back on, you know, after they did the autopsy. I mean, they sutured it back.
But those photographs that have become, you know, sort of out there in the public domain, those were actually taken during the autopsy. So that
well, if they're taken during the autopsy, then the point is they what they purposely did was take the skin flap, if it was his or a manufactured one, and put it over the wound. So you don't see the wound that I saw. The public has never seen the wound that I saw. That's the point. It's a different looking, it's just what you see is, because I looked at those. If we're talking about the same one, it's what became available 25 years later, right? It was the autopsy photos. There were like 2 photos of him laying on a slab.
There were actually a series of pictures, some of which...
Do you have them?
I do.
Yeah, okay.
Would you like me to go get those?
Yeah, you want to get them now?
I can do it right now.
Okay, let's stop this for a minute.
Okay.
Because I remember my reaction when I first saw this. The first time I saw this was, 20 years ago, or maybe I didn't see it then. I tell you, I saw it even since then. It was recent times, the last few years, that I first saw this photograph. And my assistant before you, Kim, copied this. This is public information on the internet, and she copied this photograph right here from the internet, and I had seen this. And when I looked at that, I thought of that moment and what I was describing, and this over here isn't. This has been covered up. This is covered up. It's not a flap that's been put back. You can see it's squared off here, and it's not a natural hairline. So it's been either blacked out or doctored, or what I was trying to talk about before was, I was remembering this, but if this was a real thing, then that means this would have been a big flap of tissue like this that's covering this, that was back, because when I saw him, when I took care of him, when he was still alive and we were talking about it, this whole side of the head was open, with open cranium, open brain.
Here so we can hear what you're saying.
You didn't miss that, did you?
No, I got it.
Okay. So what we were talking about is that I was standing on his right side, and this was open. This area here looks like a piece of tape, and you know, it's squared off. This isn't natural. So this whole thing was open, back here, from here to here, open. Is open wound. And you see this wound here of the neck, that is been expanded a little bit. This is what we did when we put the tube in. And that was done by, I think, Malcolm Perry, along with Dr. Carrico. I was standing right there when they did that. But I didn't do it myself. But I was observing that at that time.
Look over the next few pages. There's some pictures you might not be familiar with that have come out.
No, you're right. I'm not familiar with it. I guess I would have to front entry wound.
Well, That's the author's opinion.
Yeah, that's the author's opinion. See, but here's the back wounds. Yeah, it could be, the point is, looking at this, it could be from the back or from the front or from the side. But it could be a back entry wound with this open, and then the question is, was that tissue gone? And my impression of when I was there taking care of him is that maybe some of the skin of the flap on that whole side was crinkled up so that I didn't see it, or was gone.
There is one picture that does show the flap of skin I think you might be talking about.
Well, based on what I know now today,
there you go.
Yeah, based on what I know today, it would be a flap of skin over the whole right side of the head that's avulsed back off with the whole thing wide open. And then that means they've put that back and then glued it back or pasted it back, or what I remember, I thought sutured, but there's no sutures in here. It's sort of like pieces of tape. Now the missing evidence, this is a doctor deal?
Well, that is one of the alleged autopsy photographs.
Yeah. This is with old blood and so forth in here, but actually, you know, it wasn't that bloody. The movie depicted by Oliver Stone was bloody, but it wasn't bloody. It was an open wound, gaping, and with gray matter, with the brain open that I could see.
But the pictures you're looking at there, the pictures that we've all come to know as the autopsy photographs, that really doesn't look like what you saw in Trauma 1.
Right. Guess what? Guess what? They've got a picture of me in here.
Hold that up.
Showing the wound.
Yes.
So I have talked about it when this came out. That was 25 years later. So they've got a picture of me right there in this book. And what I see is I saw Paul Peters, Bob McClellan, and I don't know who these other people are, but these are doctors I know. And here's Dr. Crenshaw, Dr. Jones, Dr. Carrico. Interesting. So they're all talking about, they've all got their hand up here with a picture of this. But the question is, boy, this guy looks really young.
Do you have any memory of doing that interview?
No, I don't. What I do know for sure is it was 25 years or 20 years. When was that book published? Before I ever, listen, I know I never did anything. I remember, you know, I'm a busy surgeon working hard and someone says, okay, ask me a question or, you know, okay, but I never did a formal interview of any length or never told this whole.
That's by a researcher named Robert Groden. Does that name seem familiar at all to you?
Yeah, the name's familiar, yeah.
That particular book came out in '93 on the 30th anniversary.
30th anniversary, yeah. And so over what time did he write that? Maybe 5 years earlier or something?
He's been a researcher since the 70s, so there's no telling when that interview with you might have been recorded. Now, we originally were going to talk about the handkerchief. Tell me about that.
Yeah. When we were undressing him, on his right calf was a white handkerchief tied around his leg underneath his pant. And I don't know where that came from, whose handkerchief it was. Obviously, it was there, but there was no wound underneath it. You know, with a handkerchief there, I thought, you know, there would be some injury or something. But he had a white handkerchief tied around his calf, and to this day, I don't know why. But we removed it along with all of his clothes as we were getting him available to try and resuscitate him.
Could you tell at all? Did it seem like that had just been put on there, or did it seem like it had been on there for a while?
The impression I had was it was already on there. It wasn't just that someone put it on there certainly it wasn't put on in an emergency room. How long it had been there or so forth, I don't have any idea. I mean, it was just like a handkerchief like I'd have here, white, tied around there.
That's
Interesting.
Completely new information.
New information. Okay. Well, that's what I saw that day, and that's what I remembered. And for whatever it's worth, there it is.
So this visit today has sparked some renewed interest in this subject?
It sparked a lot of renewed interest for me. It's been sort of on the back burner, and not something that I've really given a lot of emotional energy tied up in that whole event, but not a detective investigation or anything about the sequence of events that led up to that. Really didn't get involved in that. But now it's sparked my interest, so I'm going to rethink it and look at it. So I appreciate it.
Wonderful.
Thank you.
Thank you, sir.
Okay.